to engage the private sector and civil society in ensuring that these policies address most of the concerns and are culturally relevant, thus making them acceptable and sustainable. During the past 10 years or so, a number of civil society organizations and several private sector companies have introduced health awareness programs and activities among their special interest groups or staff, which have begun to enhance the awareness of the need for a healthier lifestyle and existence. But these activities lacked any degree of coordination or purpose to meeting a population and country need. In the summer of 2015, the Ministry of Health committed to the formation of the Healthy Bahamas Coalition to include public, private, and civil society agencies in the bid to combat the determinants of non-communicable diseases, or NCDs. This body held its first meeting on the 23rd of September 2015 with overwhelming support from more than 40 persons from over 23 different groups from 3 sectors. Its aims were to seek to address a number of issues that impact the incidence and prevalence of NCDs, as well as reduce the morbidity and mortality associated therewith across the lifespan. The Healthy Bahamas Coalition, in addition to other roles, will serve as a national non-communicable disease commission for the Bahamas and will provide a mechanism for effective multi-sectoral action in prevention and control of NCDs at the national level through reorienting and strengthening the national response, especially with regard to risk factors. With the establishment of the Healthy Bahamas Coalition, a number of global obligations and markers are set as indicators that the Bahamas has seriously engaged in the fight against NCD will be addressed in earnest. These include action plans to reduce the harmful use of alcohol, plans to promote physical activity, plans to promote healthy diets, updating national guidelines for the management of NCDs, and promoting the use of a national cancer registry, among others. Included in a number of documents made available to provide information on the need for the national health insurance and its possible positive impact on the overall health of Bahamian people are 6 building blocks of a health system as espoused by the World Health Organization in 2007 in its document, Everybody's Business, strengthening health systems to improve health outcomes. WHO's framework for action. These are 1, good health services, 2, a well-performing health workforce, 3, a well-functioning health information system, 4, a well-functioning health system, 5, a good health financing system, and 6, leadership and governance. The first 2 building blocks of good health services and a well-performing health workforce remains the central mandate of the Ministry of Health. The execution of this work is supported in part by various councils, medical, dental, nursing, pharmacy, and health professions, as well as regulations enforced by the Hospitals and Healthcare Facilities Licensing Board. The next 3 building blocks of well-functioning health information services, well-functioning health system, and a good health financing system are being addressed by the introduction of the National Health Insurance Program. The Healthy Bahamas Coalition seeks to assist the Ministry of Health in addressing the 6th building block of a health system, namely ensuring that leadership and governance involves ensuring that strategic policy frameworks exist and are combined with effective coordination, building of coalitions, and adherence to acceptable standards, with attention paid to monitoring and evaluation for efficiency of design and accountability. The mission of the HBC, therefore, is to harness the power of civil society in collaboration with government, private enterprise, academia, and international partners in the development and implementation of plans for the prevention and management of chronic diseases. The vision of the HBC is still distilled in its motto, United for a Healthier Bahamas towards the Bahamas, where the rates of death and disability from chronic diseases among persons residing therein is monitored, evaluated, and reduced through comprehensive evidence-based programs, initiatives, and interventions. The objectives of the Healthy Bahamas Coalition are to, 1, contribute to and employ various avenues of advocacy to influence positive change aimed at reducing the incidence and prevalence of NCDs and eliminating the morbidity and mortality associated with NCDs. To build capacity among health NGOs and civil society in the Bahamas. 3, contribute to NCD public awareness campaigns and community education programs. 4, advocate for and support NCD risk factor reduction through a number of interventions, including, among others, A tobacco control and implementation of the Framework Convention on Tobacco Control. B, increase physical activity. C, improve dietary intake, including reduction of salt and sugar. D, responsible alcohol use. Support for initiatives, plans, and programs at country and organizational level. F, advocacy and support for enhanced detection and management of chronic diseases. The primary tasks of the Healthy Bahamas Coalition are to advise the government of the Bahamas on policies and actions that will reduce the incidence and prevalence of NCDs, generate networks for communication that link the 3 sectors, public, private, and civil society, to engender, to work toward the reduction of NCDs, and to communicate with and inform the wider community regarding actions required to decrease the national burden of NCDs. The Healthy Bahamas Coalition is therefore formed to 1, contribute to and lead as needed in the production of national NCD strategic plans and the implementation of their action plans. 2, focus on the promotion of prevention and control of NCDs. 3, assist the government of the Bahamas in realizing its commitments to engagement with civil society and beyond health NGOs and with the private sector to prevent and control NCDs, including conflict or interest challenges. 4, assist in building capacity in the response to NCDs among the sectors of society, but especially among private sector and civil society. 5, identify and advocate for implementation of government policies that result in reduced NCD risk. For example, subsidies for healthy food and drink. Recognize the critical role of improved prevention, control, and management of NCDs, screening and access to and delivery of quality care. 6, advocate for and promote the chronic care model to address the needs of those living with NCDs. Recommend advocacy for strengthened regional cooperation and institutions to support in-country activities. Finally, agitate for national accountability for policies and legislative actions, along with the program and project implementation related to NCDs. In conclusion, it is well understood that non-communicable diseases and associated risk factors can be linked to health systems and universal health coverage, as well as influenced by environmental, occupational, and social determinants of health, by infectious and communicable diseases, and by maternal, child and adolescent health, by sexual and reproductive health, and by aging. It is hoped that the Healthy Bahamas Coalition, through its understanding of the interrelation of various conditions and precepts, will have the opportunity to accentuate opportunities for collaboration and partnership so as to efficiently formulate activities, policies, and initiatives that reflect an integrated and cohesive approach to the fight against non-communicable diseases. So much more can be said on where we need to go and what needs to happen in this and other areas of health. Suffice it to say, through the continued demonstrated support and dedication of persons residing in the Bahamas, relying on the input and expertise of those in health and outside of health, and working in solidarity to support and implement policies and regulations that may call for a change in the way we did business in the past, in the foods we ate, in the activities in which we engaged. I am confident that the Bahamas will be successful in the slowing down and perhaps turning back our present trajectory. Ladies and gentlemen, thank you for your participation, interest, and attention this evening, and I pray that you, as you go about your daily routines, you reflect on what it is you can do in your corner and sphere of influence to encourage a healthier lifestyle and approach to wellness. I now hereby launch the Healthy Bahamas Coalition, united for a healthier Bahamas.
All right.